My name is James Harris. I'm a general surgeon for Johns Hopkins Community Physicians here at Howard County General Hospital. Incisional hernias occur in people who have had prior operations. What happens is the site of the incision from the previous operation causes an area of weakness. And that area of weakness causes a tear in the abdominal wall, which creates a hole. And through that hole, abdominal contents push through, creating a bulge and pain at that site. The most common symptom that happens in someone that has an incisional hernia is pain and a bulge at that site where the hernia is. Most people have difficulty with picking up heavy items, coughing, etc. because anytime they cough or pick up something heavy, it causes an increase in pressure within the abdomen, and that causes pain at the site when the hernia contents is pushing through the hole. Most people come to me to have their hernia fixed when it starts causing pain and a significant amount of discomfort and a bulge at the site. That discomfort that they have often limits their ability to do the things that they want to do, and that's usually when they come to see me. The goal of the surgery is to actually repair the abdominal wall. The area where the hole is, what I do is either laparoscopically or open, close the defect with suture material. And then after I close the defect, I actually use a type of mesh, which is it's essentially like a sterile plastic. It's a polypropylene material that you use to reinforce the area of the closure so that it doesn't rip back open again. If you close the hole with suture alone, the likelihood of it coming back is quite high, especially when the defect is larger than 1 to 2 centimeters. So my practice is to close the hole, restore your normal abdominal wall integrity, and then put a piece of mesh there to serve as like a scaffold to keep it closed. In most cases, I'm able to do this operation laparoscopically. There are some situations where the hernia defect is so large or there's so much scar tissue that I'm not able to do it laparoscopically. In those situations, I have to do a traditional open approach where you have a bigger incision and more pain. When I'm able to do it laparoscopically, depending on the size, some people could go home as soon as a day, some people go home the same day as the operation, sometimes you need a couple of days in the hospital. It really depends on the size of the hernia as far as the extent of the operation and how long it takes to recover from the operation. Most people, have some pain. I tell people for the smaller hernias, the average time that you need to be on pain medication is about a week. I tell people that they can't do any heavy lifting for a full 6 weeks after surgery. And the reason why is it takes 6 weeks for your body's scar tissue to be at its peak. And if you were to go to the gym or do some heavy lifting within that period of time before your body's done healing, you actually put yourself at risk of developing another hernia. These hernias do recur. The risk of recurrence is about 10%. The way that you can help decrease the likelihood of recurrence is to avoid any strenuous activity or heavy lifting after surgery. And as I said, I tell people to wait about 6 weeks before you're doing kind of heavy lifting, nothing more than 15 pounds, no sit-ups or any kind of straining because it puts undue stress on the area of the repair.